Mr. President.
Senator from New Hampshire.
Thank you, Mr. President. I rise today to talk about a public health issue that is devastating communities and families in New Hampshire and throughout this country, and that's prescription opioid and heroin abuse. And I actually see my colleague from Rhode Island, and I see my colleague from Massachusetts here, and this is an issue where on a bipartisan basis, we are focused on important legislation to address this terrible public health crisis. Right now in New Hampshire, heroin, sometimes combined with a very powerful synthetic drug called fentanyl, is taking lives, ruining families, and harming communities. Public safety officials are confronting overdoses every single day. My good friend, Manchester Police Chief Nick Willard, he said recently, "I'm up to my eyes in heroin addiction." Unfortunately, the statistics underscore Chief Willard's statement. In all of 2014, Manchester Police seized over 1,300 grams of heroin. As of just last month, Manchester Police had seized over 27,000 grams of heroin in 2015. That's nearly 26,000 plus more grams in just 7 months, Mr. President. In 2014, there were over 320 fatal drug-related overdoses in New Hampshire, up from 193 in 2013. And heroin and fentanyl were the primary drivers of nearly 250 of those deaths. In Manchester alone, our largest city, overdose deaths so far have increased 90% over 2014, and over 269% if we go back just to 2013. That's what a crisis we're facing. That is how many lives are being taken by opioids, by overdosing on prescription drugs and heroin, and it is devastating. Law enforcement, I worked with them when I was Attorney General of New Hampshire. I know how hard they are working on this. They're working tirelessly to get these drugs off the streets, but they'll tell you we simply cannot arrest our way out of this problem. I've actually heard from law enforcement in New Hampshire that they believe what we need most to confront this public health crisis and to confront the public safety issues that go with it are more prevention, more treatment options, and more support for individuals in recovery. We know that addiction to prescription pain medication can often become a gateway to heroin abuse. And unfortunately right now, the price of heroin on the streets has gotten so cheap that people are often going from prescription drug addiction to heroin addiction because of the price and the high and the way that they feel. It is so tragic. According to a study from the Substance Abuse and Mental Health Services Administration, approximately 4 out of every 5 new heroin users previously used non-medical prescription opioids before using heroin. I want to briefly mention 2 pieces of legislation that I believe represent critical steps in the right direction. In February, I helped reintroduce the bipartisan Comprehensive Addiction and Recovery Act, and I want to thank my colleague from Rhode Island, who is in this chamber as well, for his important work on this legislation. This legislation would expand opioid prevention and education efforts and expand the availability of naloxone to first responders and law enforcement. It would also support additional resources to identify and treat incarcerated individuals suffering from substance abuse disorder, and encourage prevention by expanding drug take-back sites to promote the safe disposal of unwanted or unused prescription drugs, strengthening prescription drug monitoring programs, and launching a prescription opioid and heroin treatment and intervention program. This summer, I had the privilege of doing a ride-along with the Manchester Fire Department. And within a half hour of being at the fire department, we were called to a heroin overdose. I watched the first responders give Narcan to a young man who was on the ground, who I thought was going to die. And he came right back. But you know what I noticed in that room, Mr. President? I noticed in the corner an infant child that firefighter took and gave to another young woman in the room. And you think about the impact of that. What chance does that child have when her father is on the floor and is not getting treatment, is getting back in this cycle? Because often what I hear from our first responders is that when they save someone's life using a drug like Narcan, they see the same people again because they're not getting the treatment that they need to get the recovery that they need from this horrible addiction that they have. Earlier this year, I also reintroduced the Heroin and Prescription Opioid Abuse Prevention, Education, and Enforcement Act with Senator Joe Donnelly of Indiana. This bipartisan bill would reauthorize programs related to prescription drug monitoring programs that are helpful to our physicians so that they can get good information when they're prescribing pain medication, and grants for local law enforcement, and establishing an interagency task force to develop best practices in prescribing of pain medication. The headlines that we're seeing in New Hampshire every day in our local newspapers underscore the sad reality of this problem. Here are some that we've seen in recent weeks. In the Union Leader, mom, dad on heroin while bathing a child. In the Nashua Telegraph in May, 9 die from drug overdoses in Nashua so far this year. That's where I was born and where I live, including 3 in one weekend, Mr. President. In the Telegraph, again on May 14th, toddler left in the care of men, one of whom died in an overdose. And there's more. On that same day, Hampton man on heroin causes 5-car crash. May 29th, Ossipee mom accused of selling heroin with 2 kids in the car. These news stories mirror the heartbreaking personal stories of loss I've been hearing about from families in our state. I just want to share a couple of these stories with you. Recently, I met with the family of Courtney Griffin, a 20-year-old young woman from Newton, New Hampshire. Tragically, Courtney lost her life to a heroin overdose last September. I was very moved by her family's story. Courtney aspired to join the Marine Corps and had already attended boot camp. She was a charter member of the Kinston Lions Club. She played the French horn in high school and was a member of the tennis club. But during high school, Courtney started hanging out with a different crowd. And at some point, the Griffins' prescription medication in their cabinet started disappearing. After Courtney graduated from high school, her addiction grew worse. She was stealing from her father's business and from her family in a desperate attempt to feed her addiction. Courtney entered drug treatment, but she relapsed. And when she finally admitted that she had a problem, she tried to seek treatment, but was denied coverage because the Griffins insurance company said it wasn't a life or death situation. With some help from local law enforcement, Courtney was finally able to find a place to receive treatment. Tragically, she died of a heroin overdose about a week before she was set to begin treatment. Her father, Doug, is doing everything he can to turn Courtney's story of tragedy into a cautionary tale so that he can save other families from what his family has been through. Doug and others like him have a perspective on this crisis that is impossible for anyone who has not personally experienced a loss like this to understand. And I admire his courage in sharing the story of his family so that he can save other families' lives. Unfortunately, this story is all too common, Mr. President. In April, Molly Parks, a waitress at Portland Pie Company in Manchester, lost her life to a heroin overdose while she was at work. Her father is also speaking out to warn other families of the dangers of drug addiction. And I want to share, as a final point, one story that really moved me on Memorial Day. And that story came from Keith Howard. He served our country with distinction. I know him personally. When he returned home from his enlistment, he struggled with alcohol and heroin abuse, and he became homeless. Unfortunately, we hear too many of these stories about our veterans with what they're carrying with them, the wounds from war, that become addicted to drugs and alcohol. And Keith was one of those individuals who served our country but yet became addicted. Today, Keith is sober, and he helps run Liberty House in Manchester, New Hampshire, which provides sober housing for American veterans transitioning out of homeless to help our homeless veterans. Keith has dedicated his life to this. On Memorial Day, on that important day where we honor those who have sacrificed so much and made the ultimate sacrifice for our freedom, he shared stories with us of veterans who have come to Liberty House and turned their lives around. But he also shared stories with us of others who came but could not overcome their addiction, eventually costing them their homes, their families, and in some cases, their lives. Keith and the Liberty House are doing incredibly important work for veterans in Manchester, but he believes there's more to be done. And on Memorial Day of this year, when we were honoring those service members who gave their lives in service to our country, Keith reminded us of something else when he told a crowd at Veterans Park in Manchester, and you could have heard a pin drop, Mr. President, when he said this: "Let us honor our dead by creating hope for our living." He is absolutely right. It's clear to me that we need to work together. This is a bipartisan issue. This is a public health crisis. This is about the quality of life in our country. And this is a problem that we need to work together at the local, state, and federal level in partnership to identify effective strategies to help save lives, take back our communities, and for my part, I will remain committed to fighting against this public health epidemic and taking it up at its roots to make sure that for our children, that this addiction and heroin, that we get it off our streets, but that we get help for those who are addicted, and they understand that they shouldn't feel the stigma that I know many of them do, that we want them to come forward, we want to help them, and we understand this is incredibly difficult, and we want to know that we stand with them so that they can get the help to lead and the treatment that they need to lead productive lives. So I thank you, Mr. President, and I yield the floor.